So, my name is Reena Rupani, and I'm going to be your host for today. And for me, health was very important. When I was growing up, I would see people going to doctors and my elders going to hospitals. And I would always think, what do I do that I never need to go to hospitals and doctors? Because I don't like medicines, I don't like injections, I don't like treatments. And, ask and you shall receive. And this was kind of something that I really wanted. And Sharon just came into my life and changed my life 10 years ago. My acidity disappeared. I lost 17 kilos in 8 months. My parents' diabetes and blood pressure medicines stopped. My husband's cholesterol tablets stopped. I mean, I saw so many benefits and I joined Sharon, and it's been nearly 10 years now. And I've seen such amazing cases of reversal and prevention, and we all are in the right place. And for me, I always thought that you get sick, you go to a doctor, he writes a prescription, you have the prescription and you're fine. But it's only when I joined Sharon that I realized that our health is actually in our own hands. And that's what we're going to be talking about today: principles of healing. What are the natural principles of healing and how we can be our own best doctors? And who better to tell us this than Dr. Nandita Shah herself, because she's been practicing this. She was a homeopath. It was a rare disease, autoimmune disorder called Guillain-Barré, which made her bedridden and which made her realize that there is some changes that she needs to make. And it's when she made those changes and discovered the whole food plant-based diet, there has been no looking back. And she's so connected to nature. Every time we listen to her, we learn something new. So I'm sure that we all are going to learn something really, really new from her today. I must also add two very important things before I call her over. She's also the recipient of the Nari Shakti Puraskar, which is the highest award for civilian women in our country. And why did she get this award? Because she's helped thousands and thousands of people prevent and reverse diseases. And when I'm talking about reversal, means no more medication and no more disease inside the body. And she's also the author of the bestseller Reversing Diabetes in 21 Days, founder of Sharon. And Sharon's mission is building a culture of health. That is why this talk is so very important today. Doctor, over to you. Thank you.
Thank you, Reena, for that lovely introduction. And today I have so much to share that I'm going to start with my PowerPoint right away. But I just want to tell viewers that the reason that I chose this topic is because I have patients who get better and then they get a fever or they get a cough and they say, what shall I do for that? And my goal is that everyone should be their own best doctor. And I do believe it's possible. And in order to be your own best doctor, you have to understand and actually understand at a very deep level the principles of healing. Now, what I believe is that animals understand the principles of healing. And so can we easily understand it. And so I hope to make it very easy for you today. So today's topic is principles of healing, or rather Sharon's principles of healing. And that's because, when we're interested in healing ourselves, then we often look at alternative systems like acupuncture or homeopathy or Ayurveda or even naturopathy. And all of these are excellent. And I just want to explain what is the difference between our system and all of these systems so that you have the knowledge to pick and choose the right thing at the right time. You already know Sharon stands for Sanctuary for Health and Reconnection to Animals and Nature. And as I said, animals in nature know how to stay well. Today's program, we will discuss lifestyle diseases that we face today, the logic of nutrition as medicine. And those of you who are not new, you probably know these few things, but I hope that I'll be able to share something a little different today. How our body always works to heal, Sharon's principles of healing, causes of disease, how to make a meal plan so that you can always be healthy. Now, today we have so many lifestyle diseases, right? And I'm sure that Many of you, thanks to what you're already doing, don't have them. But we know that we live in a culture of disease where our friends and relatives and all have all kinds of diseases. I'm just mentioning a few of them that are very common: obesity, diabetes, high blood pressure, heart disease, cancers, chronic kidney disease, autoimmune disorders, asthma, and upper respiratory tract disorders. These are things that I am seeing day by day. And we know that obesity also causes so many of these diseases. And when most people get sick, they line up at doctors' clinics to get medicines, thinking that medicines can cure. But we know now that medicines never cure, right? That means if we have a lifestyle disease, of course, if we have a lifestyle disease, we need lifestyle to cure it. But even if we have, say, an acute illness, a fever, we all know very well that if we take Dolo and antibiotics, it can get rid of the fever for a while, but after some time, I mean, right away, you are as prone to reinfection as you were before, because all antibiotics can do is kill the bacteria that's harming you. It doesn't prevent the next bacteria from coming in again. And I know that when I was a young doctor, I used to see plenty of kids who used to get repeated tonsillitis and go on medications and antibiotics and come back and again tonsillitis. And I had to tell them that these antibiotics have to stop, because antibiotics are great, but they should be used only in circumstances where nothing else will work. Otherwise, we are overusing them and it has no meaning at all, because our body works to heal all the time. And medicines never cure, right? People have lifestyle diseases like diabetes and hypertension and take medicines their entire life. And even with cancer, if someone takes chemotherapy, what can chemotherapy do? It can kill all fast-growing cells, including cancer cells. So it kill cancer cells and it will kill the red blood cells and white blood cells and even hair cells and mucous membrane cells. Your digestive tract will be affected. It feels like taking 10 antibiotics all at once. And yet, it doesn't cure, because we know so many people who get recurrences. Why do they get recurrences? Because we haven't removed the cause of the problem. So all we have done is kill fast-growing cells, but we haven't removed the reason why these fast-growing cells are growing, and therefore it comes back. So logic of nutrition as medicine is that we should be eating what nature or God designed for us to eat. That means, just as every animal does, that means if we have a cow, we would feed it grass, because instinctively a cow eats grass, and instinctively a lion would eat meat, so we would feed the lion meat. But when it comes to us, we are taught since childhood that we are omnivores, and we are not in touch with our instincts, and we are in touch with our culture, our society, and what our parents teach us to eat, who have been taught by their culture. And so we are, but let's get in touch with our instincts right now, okay? If you were on a farm or an orchard and you see fruits and vegetables ripe and ready, what do you feel like doing? And because today is so long, I'm going to answer it for you, but I know that you all have the same answer as me. You feel like picking and eating it, of course, right? But if we see a chicken walk by, or a goat, or a cow, our mouth doesn't water, because instinctively, it's not our food. We, like other primates, can't pounce on these animals, tear them apart, or eat them raw. And when a real carnivore or an omnivore eats these animals, they would eat every part of it, skin, bone, in the case of chicken, beaks and claws, everything. But we can't eat that. So who would salivate if they saw a chicken walk by? A dog or a fox, because a dog or a fox can kill this animal. And that means we're eating dog food by mistake because of our culture. And obviously, if you see something like this in a restaurant, because of our conditioning, we would feel tempted. But we have to understand that that's because it's cooked and because of our conditioning. It's not our food. So foods suitable for us are the ones that we are instinctively tempted to pluck and eat. If you look at the teeth of carnivores and look at the teeth of a herbivore and look at the teeth of true omnivores, then you can see right away that true omnivores have canines which are totally different from our teeth. There are some monkeys that are true omnivores as well, but we don't have, we call one of our set of teeth canines, but they're not really canines because they can't tear apart an animal. Now, we also know, living in India, where so many people are vegetarian, that vegetarians and non-vegetarians get the same diseases. And that's because milk and meat have the same properties. So when non-vegetarians consume chicken, vegetarians will consume paneer, and it's all the same in our body. So when I say milk, I mean everything that's made from milk. Milk, cheese, butter, cream, paneer, ice cream, ghee, curds, buttermilk, and even biscuits and things, anything that has milk in it. Milk sweets, for example. And we know very well that every mammal produces milk only for their young. And it's only because of our culture that we believe that cow's milk is for humans. It's not. And even a baby knows that because every baby loves their mother's milk. But when you first give them cow's milk, no baby appreciates it, right? That's because instinctively it's not our food. But we are being manipulated by advertising all the time, and we end up buying these things. So what we have to understand is that these foods are not suitable for us. And whatever is advertised, nobody's going to spend money to inspire you to buy something that is in your instincts. That's why we don't see advertisements for carrots and cucumbers, but we see advertisements for all other kinds of things. When you can make a list of everything that's advertised and don't eat that, and you will be fine. So foods suitable for us are never advertised. Now, there's one more thing, that we are the only species that makes our food less nutritious before eating by refining. That means taking out the most nutritious element of the food and eating the rest. For example, if you have brown rice and you take out the outer layer, the most nutrient-rich layer, then you're left with white rice, which everybody eats all the time. Or whole wheat is good, but maida is not. And oil and sugar, we all know, have no nutrients, but the maximum nutrition of anything is just under the skin. And therefore, we have to eat whole foods. That means eat the part of a food that a monkey would eat, because monkeys are our nearest relatives. So you could eat a watermelon like this, or you would peel your bananas, but you would never peel your apples, right? So we also don't peel vegetables, which we are so used to peeling in our culture. Don't peel your potatoes, don't peel your carrots or cucumbers, not even your pumpkins and bottle gourds. Nothing except for maybe onions and garlic and peas, the things that you can peel with your bare hands. Now, we are living in a culture where most of the food that is sold in the market has been sprayed with poison so that other animals don't eat it. Isn't it crazy that we consume foods that we prevent other animals are smart enough not to eat. And sometimes people wear suits so that the pesticide doesn't come on them. It's that poisonous, but we are consuming food sprayed with that. And therefore, it's so important to eat 100% organic. Now, these are our basic principles. We need high quality spare parts in order to heal. Nutrients are the spare parts for healing. And so we should consume all the colors of the rainbow, if possible, every single day. And then we'll have all the nutrients we need. And our body will tell us which ones we need the most just by giving us signals through our taste. So if you love oranges, that means you need the nutrients of oranges. And if I love blueberries, then I need that, right? So we're instinctively attracted to colors. And the food industry tells us that, okay, we're attracted to colors. So here are all these colors. And, if we were buying packaged food, we instinctively feel like buying all these colors. Let's taste all the flavors. That's why it's really important not to buy these chemically laden packaged foods. So what we recommend is eating as close to nature's design as possible, fruits and vegetables. Lots of, or rather only plant-based foods, whole foods, organic foods, more raw foods, because every animal in nature eats their food raw, right? And avoid all addictive substances and processed foods. Like, don't consume things you wouldn't give to your children, such as even tea and coffee, right? I mean, even if we can't stop consuming tea and coffee, we should recognize that these are not the best foods for us. Now, this is just what should we eat. Now we're going to go into the principles of our healing methods. And the first is that the body always works to heal. And the body is always right. So body works to heal by producing symptoms so that we recognize that, hey, we're doing something wrong. How can our body tell us that we're doing something wrong? By producing symptoms. And if we can find out what we should change so that the symptom doesn't occur, we will get cured. We have to think about, what did nature expect? Like, we're eating foods that nature expected. But sometimes we're doing things that nature didn't expect. For example, people often stay up till late at night after midnight and then sleep until early morning. No, there's a reason it's dark at night, right? But now we don't recognize that because we have all these lights that are on and all these digital devices. But really, if you want to understand nature, the best way is to go out and camp in a farm or in nature and just experience. How can we go as close to that expectation that nature had as possible in a sustainable way? And what I mean by sustainable is that, yes, all animals eat their food raw. Therefore, the best food for us is raw. But if today you're eating a regular diet and you say, okay, now I want to go 100% raw, that might not be sustainable. Because I've seen people go raw 100% and then they bounce back into eating other foods. So let's go in a step-by-step manner. Let's not expect too much of us, but our body is so smart that it will guide you. So you will be improving all the time as you go ahead. Now, if you understand these and just understand that nature is our guide, then you will be able to answer all kinds of questions that you may have right now, like this. How will I get enough protein on this lifestyle? If we just think about nature, then we know very well that all the herbivores in nature, even fast animals with powerful muscles like horses or huge animals like elephants, get all their protein just from plants. In fact, plants are the only producer of proteins in the world. Animals have proteins because they eat plants, right? So we don't need to go to animals to get our protein, because we know very well that all the herbivores are getting their proteins from plants. Now, just an additional bit of information that you may not know from nature is that every single cell contains protein. DNA and RNA are protein. So you cannot escape protein if you're eating food, right? And we also know that very few people in this world suffer from protein deficiency. If I were to ask you, what is protein deficiency? You might not even know the symptoms of protein deficiency. And that's for another time, but just today, to understand that protein deficiency is not a problem with this lifestyle. Another question, should I eat honey? And if we were to think about nature, then we know that if you see a beehive, will your mouth water? No. The answer is no, right? And therefore, it's not our food. Or how much water should I drink and when? And I always say, listen to your body. So drink when you're thirsty and drink as much as your body asks you to drink. But now many of us are out of touch with our thirst. We are out of touch with our body. So what can you do? You can watch other animals. And I have been watching animals. I always watch animals, and I see that animals drink soon after they're eaten. So should we listen to nature, or should we listen to books that tell us, don't drink right after eating? Right? Because often if you don't drink after your meal and you get up and you get busy, you might forget to drink. So we have to listen to our body carefully and drink when thirsty. How much to drink? According to your body. Now, truly, if you eat a lot of raw food, you may not be thirsty all the time. But if you eat cooked food, dry food like chapatis or even rice, then you may be more thirsty. But your body will tell you this. You don't even have to think about it. But we have to learn to listen to our body and not books. Or is wheat good for me? If we just think that if we see green fields of wheat, does our mouth water? Maybe not, right? Because we can't pick that wheat and we cannot eat it raw. And that's why so many people have gluten intolerance, because truly the seeds of wheat are for the birds and the grass of the wheat is for cows. And we shouldn't even be eating wheat. But for our first transition, let us just work on making sure that our food is plant-based, whole, and organic, because we might not be going to raw food right away. And therefore, if wheat doesn't bother you too much, that means if your body isn't telling you to stop wheat, then you can have some. Isn't milk a complete food? Of course, milk is a complete food, but it's a complete food only for the person who it was meant for. Cow's milk is for calves, mother's milk is for babies, and mother's milk is a complete food until baby gets its teeth, and then it's not a complete food anymore because now baby has to start consuming other foods. Or is getting organic foods totally necessary? If animals stay away from sprayed foods, food sprayed with chemical pesticides. Shouldn't we be running away from it as well? And think about it. Chemicals are the causes of, we all know, cancer, because chemicals are carcinogens. And we also know that chemicals are hormone disruptors. And so many of our diseases today are hormonal problems, like diabetes, insulin is a hormone, or PCOD, or hypothyroidism, or infertility, or prostate enlargement, or breast cancer, or prostate cancer, or ovarian cancer, or premature puberty, menstrual problems, menopausal problems. These are all hormonal problems. Why does Sharan recommend only 10 nuts a day? Because Sharan is very generous. Truly, if we think about it, nuts are hardly our foods. Because if you see nuts at the bottom of a tree, say if you see walnuts are relatively easy to open with a stone. You can take a stone and open those walnuts. But if you were to do that, how many walnuts will you eat in a day? It's only because we're getting packages of shelled walnuts that we can gobble them up, right? And if you have ever seen almond trees or almond fruit, and many of us have not because we're so used to getting shelled almonds, but almonds come in a shell just like the kind of center of a plum or a peach, right? The fruit looks like that. It's probably from the same family. And so it's difficult to get inside an almond shell. Now, why did God make it difficult for us to get inside that? Because it's not our food. So God said, let me protect human beings by not letting them get into nuts. Nuts are to grow new trees, and nuts are for certain other animals, like maybe squirrels who know how to open them, but not for human beings. And cashews are even more difficult to open, and pistachios cannot even be opened without heating, right? So these are not our foods. Or are supplements necessary? God would never be forcing us to buy supplements from a pharmacy. But today, because of our artificial lifestyles, we do need certain supplements. Those are only vitamin B12 and vitamin D, which means that we don't need to have multivitamins or multi-B vitamins or large doses of vitamins. We only need that which is required because of our artificial lifestyle. And if we were to live in nature, be out in the sun, we would not need vitamin D supplements. And if we were really living in nature and drinking our water from the river or the pond and not having mobile phone towers everywhere or no mobile phones in our pocket, we wouldn't even need vitamin B12. Is intermittent fasting good? Today we have a kind of fad of intermittent fasting. But if we think about it, what is intermittent fasting? Intermittent fasting is eating only 8 hours during the day and spending 16 hours not eating, which is a beautiful procedure because, when we're not eating, that's when our body can do healing. So if we give our body 16 hours of healing time every day, then we'll never get sick, right? So 8 hours. Now think about it. If we were living in nature, you cannot eat before sunrise and you cannot eat after sunset because you cannot go and pick your food before sunrise or sunset. That means if we were living in nature, we would already be doing a kind of intermittent fasting. Maybe not strict 8 hours, maybe 10 hours, but we wouldn't be eating more than 10 hours a day. So there is a lot of logic in this. And if you sleep on time, then you won't be eating more than 8 hours a day. Don't eat in the morning before you're hungry. don't eat dinner. If possible, don't eat dinner after sunset. But if you can't, don't eat dinner after 8 p.m. And so automatically you'll be doing a intermittent or semi-intermittent fasting. Maximum healing takes place at night during sleep between 10 and 4, which is why when we have fever, we automatically feel like resting. Even if you get a big injury, you feel like resting. And that's why hospitals don't allow visitors all day long, so that patients can be totally resting and healing fast. Now, another question. Aren't coconuts and peanuts too rich in fat? Think about it. Nature is always right. We just have to think that nature is always right. For example, peanuts are easy to open. They're not nuts. They are actually legumes from the same family as peas. And they're even called monkey nuts because monkeys love them, because they can be easily opened. So these can be eaten in larger quantities. But you know, nature is so wise that nature puts them in these shells. So it takes a little time to open. And so we'll be eating it at a slower pace. But if you buy peanuts ready-made and already shelled, then we have to be a little careful because peanuts can be a bit addictive, can't they? Like you can easily eat a lot of roasted peanuts and say, oh God, I ate too much. What about coconuts? Coconuts come in two kinds. One is tender coconut and coconut water, and the other is mature coconuts that we break open and maybe use in chutneys and other things, or to make coconut milk. Now, truly, if you think about it, you know, I live on a beach, and so I have coconut trees around me, and the mature coconuts fall. But to get a tender coconut, you've got to climb the tree. So tender coconut is not our natural food, right? It's also difficult to get into. But a mature coconut can be broken on a stone and gotten into. So we should just think that coconuts are fine. Coconut is an amazing food, and nature has protected us from getting too much fat because of the fiber. You can't overeat coconut. But if you have coconut milk, you can overeat. If you have, that's refined. And if you have coconut oil, of course, then we're done for. Are hand sanitizers helpful? Now, hand sanitizers are for people who are afraid of bacteria and virus. But our body is not afraid of bacteria and virus because our body knows how to handle bacteria and viruses. In fact, we are surrounded by bacteria and virus right now, and our body is handling it and we don't even know it. So when our body has to handle bacteria and virus, it gains immunity, which is good for us lifelong. And if we allow our body to be in touch with bacteria and virus in small doses all the time, we'll hardly ever get sick, right? So hand sanitizers are chemicals. I saw plenty of patients during the hot COVID times getting eczemas and things from hand sanitizer. We should really watch them. Now, if we have the question in our mind, the chance is that the answer is also within us. But we have to think, and you all will be able to think once you understand the principles of healing. So I'm going to tell you a little bit more. Okay, we talked about nutrition. These are actually 10 steps. 8 of them are here. 10 steps that Dr. Lorraine Day, who got a cancer where her tumor was the size of a marble, and she didn't get it operated, and it grew to the size of a grapefruit. And she said, I'm not going to remove my tumor. She's a doctor, an orthopedic surgeon. And she said, I'm not going to remove my tumor because this is a symptom. This is guiding me and letting me know where I am on my healing process. Without symptoms, how do we know where we are? And so once she cured her cancer, she is helping many other people naturally heal cancer. So she says that there's a 10-point plan: nutrition, exercise. Naturally, we're supposed to move. That's why we have limbs and muscles. Water. Now, your body is going to tell you how much to move, how much to drink. Sunshine, right? Nowadays, we don't get enough sunshine. And if we do, we're in urban cities where the air is polluted and so we don't get direct sunlight. But if we go on a holiday and if you can get direct sunlight, don't miss that chance. And then temperance. Temperance means staying away from addictive substances like alcohol and smoking and tea and coffee and even other drugs. And then fresh air. Sometimes we're sitting in a heated or air-conditioned room all day long. And rest at the right time. At the right time is important. And trust. Trust that your body or God knows how to heal you. Always look for answers within yourself. The answers are there. If animals have their answers, how can we not, right? And the other two, which are not here in this diagram, are, she's given an acronym for this. New Start AB. Nutrition, exercise, water, that's new. Sunshine, temperance, air, rest, and trust, that's start, new start. AB. A stands for an attitude of gratitude. We need to be grateful for what we have because we have so much, but often we think about what we don't have. And benevolence, because the more you give, the more you get. Okay, so these were her principles for healing, which I really like. Now, what is the difference between this kind of healing that we're doing now and naturopathy? Naturopathy means do things that are natural, that are not very harmful, and that will be helpful. Like, for example, all kinds of procedures like packs and enemas and drinking urine or sun gazing or healing herbs and medications or a fixed dietary regimen that at this time you do drink this and this time have this kada and this time you should do that and so on. Or even fasting or an exercise regimen. So this is good because it gives us guidance. But what is the best guidance in the world? Our body. So if we can learn to listen to our body, then we may not need any of these, which are once again a symptomatic treatment. So all the other systems of treatment, and Sharan's is not even a system, it's just what would animals do or what would you do if you lived in nature. But all the other systems of treatment treat symptoms. Okay, you got pain or you've got gas. What allopathic medicine or Ayurvedic medicine or homeopathic medicine will I take to get rid of the symptom? Or what naturopathic procedure will I do to get rid of the symptom? But our system is, let us think, what is the cause of this problem? Because if we get rid of a symptom, we will have to do that procedure every day or often. But if we remove the cause, the symptom will go away. Just like Dr. Lorraine Day said, I'm not going to remove my tumor because that's the symptom that's guiding me to learn how to heal so that the tumor dissolves. Right? So we have to always look at the level of cause. I hope I'm making myself clear, and don't forget that there will be a time for question and answers in the end. So please do write down your questions. I'm not going to interrupt to answer the questions now because I'm hoping that I'll answer them during the talk. But given that, we have 1 hour and I may not be able to cover everything because I'm already going slow, we will try to answer it in the end. So the body always works to heal. We should work to understand and remove the cause. So what are the causes, the common causes of disease? Number one, lack of understanding. That we don't understand nature's ways, so we look for medicines. Or wrong nutrition. Or medicines. Medicines themselves cause so many side effects. Or chemicals. Or chemicals that come from many different places. We'll talk more about that later. And lack of exercise and stress and lack of rest and lack of fresh air and electromagnetic frequencies. All these digital devices, remotes, even LED lights, leave alone mobile phones and 5G. And of course, a wrong attitude. So, lack of understanding, we have already talked about. We've talked about nutrition and medicines, cause diseases. Sorry, I'm going through this again. I made 2 slides. Sorry about this. Now, nutritional causes of disease are, number 1, excess fat. What is excess protein? Sometimes we think that more protein is better, but we'll see more about that today. Lack of fiber and empty calories and chemicals. Excess fat can be fat in your body, but it can also be fat coming from foods that are full of fat. Where is the fat coming from in the food? It's coming from all the animal products, because animal products are full of fat. Boiled milk, you get fat on top. Boiled chicken, you get fat on top. Boiled fish, you get fat on top. Meat, all animal products. As well as all refined plant fats. Refined, that means oil, ghee, butter, which are animal fats, any kind of refined plant fat, all the different kinds of oils. Now, when this fat goes in our blood, what happens? Here you see a test tube of blood which has been centrifuged, so that you can see the plasma on top and the red blood cells at the bottom. And next to it is another sample of someone who has eaten just 4 hours before. And they've eaten a normal meal, and you can see the fat in the plasma, which is making the plasma turbid and thickening it. And our heart has to pump to push the blood to every single cell in our body. So many cells, so many blood vessels that are tiny. And if we make the blood thicker so that the heart has to push the blood everywhere, then it's going to be a problem. So this thickened blood injures the artery walls, causes a tear in the artery wall, as you can see from this diagram that my pointer is pointing at. And over a period of time, this is bandaged with cholesterol, and cholesterol gets deposited in the arteries over a period of time, narrowing the arteries. And then we have something called plaque. And this plaque can even break away from the arteries, blocking another artery that's even narrower. This will cause sudden problems, like a sudden heart attack or a sudden stroke. And this is something that I got from Forks Over Knives. This is a diagram that shows the mortality from heart disease over a period of time. So in 1927, when people hardly ate animal products, why? because there was no fridge. Because it was not that easy to get animals in nature and kill them and eat them. So they hardly ate animal products, and they had very little disease or heart attacks. But over a period of time, as we got refrigerators and we got systems of raising animals for food, animal agriculture, as they call it, the number of heart attacks increased until World War II, when the Nazis invaded and they took all the Norwegians' animals away from them for their own troops, and the disease, the heart disease in Norwegians fell, thuk, until 1945, when the war was over. And the Norwegians got their animals back, and they also got their heart attacks back. Can you see the graph? It's going up again. So, heart disease can be reversed. This is a angiogram of a doctor. Imagine a doctor who at the age of 44 got a severe heart attack, so severe that bypass surgery could not be done because the artery that was affected was far too long. As he changed his diet, the artery became normal again just through right food. That means most of the bypass surgeries may not be required. We can reverse heart disease just with food. And diabetes 2 is caused by fat inside the muscle cells that cause insulin resistance. They block the insulin receptors and the insulin doesn't work anymore. Animal fat intake is also connected to breast cancer. The more animal fat we eat, the more likely we are to get breast cancer. And countries which consume the most animal products, as you can see right up there, Netherlands and Denmark and UK and Canada and New Zealand, we know all this, and US and Ireland. These are the countries which have the maximum incidence of breast cancer. And of course, fat causes obesity, and obesity is the root cause of many diseases. Now let's go to protein that we think comes mainly from animals. And excess protein causes disease. Rarely do people have lack of it if they have enough food, because protein, as I said, is found in all cells. And so what does excess protein cause? Osteoporosis and kidney disease and gout and acidity and cancer. Protein is the food for growth and repair. Cancer is a growth. And allergies and autoimmune diseases. And I don't have time to explain the reason for all of these, but you can see this in my other talks on protein or talks by other people as well in Sharan. And diseases linked to lack of fiber. Lack of fiber causes constipation, and constipation causes so many other diseases, even causes absorption of toxins within the intestines, causing colon cancer and rectal cancer, and also causing piles and fissures and so on. And of course, empty calories cause us to become fat, and chemicals can be found in packaged food and non-organic food, of course, and also all the things that we put inside our mouth, but also on our body, are absorbed. If you put oil on dry skin, it's gone in some time. So all these hand sanitizers, but also soaps and shampoos and perfumes and deodorants and hair color and cosmetics, all of these are chemicals that are getting absorbed, and we should be watchful of them. And then home care chemicals. Home care chemicals like window cleaners and toilet cleaners and all those sprays, or also air fresheners and, the carpet cleaners, the phenyl, the agarbattis, anything that we're using for home care, which has an odor, is entering our body through our breath. And of course, I should never forget medicines. Medicines are chemicals, and that's why we want to minimize medication. Now, everything that goes in our body breaks down by the liver and is excreted by the kidneys. And so chemicals cause liver complaints and kidney disease, but they also cause hormonal complaints, as I already mentioned, and of course, cancers, because chemicals are carcinogens. And that's why we need to minimize the chemicals. I already mentioned that two important supplements that we should always take are vitamin B12 and vitamin D. And Reina told you that mind and body are important. Actually, mind and body are connected, which is why we're having a talk this evening on mind, because, yesterday was World Health Day, and this is all for World Health Day. Now, why are we so stressed these days? Because we are trying to live by societal expectations, because we're lonely, we're busy on our phones and not meeting people. We are forcing ourselves to do things against our basic nature, and we are creating an energy of fear and violence around us. How are we doing that? By animal agriculture. Imagine if you're in a room where someone is stressed and angry. You feel that, don't you? Well, in the same way, imagine the earth as a big room where we have energy of separation, of violence, of fear, of starvation, of suffering. And we are creating this through animal agriculture, where babies are separated from their mothers, where animals are kept in close confinement in their own excreta, which they would never live in if they had a choice. So that, this energy is all over the earth today. And we can change this. We can actually change our state of mind. By not eating animal products, you will see a big change in your state of mind. And we can change the state of mind of our planet by changing what we put in our mouth. So now, meals to heal with a plant-based diet. How are we going to plan our meals? Wake up and rehydrate. The best way to rehydrate is water with a bit of lime juice. So you start the day with vitamin C, or if you are used to tea and coffee and you want to replace that, you could have a herbal infusion, like a herbal tea. And then breakfast, no matter what, if you were living in nature, the first thing you would pick is fruit. And the best way to have fruit is either directly or in the form of a green smoothie. The green smoothie adds nutrients to the fruit because green leaves are the most nutrient dense, most protein filled vegetables in the world. And so green leaves and fruit, not other vegetables, not zucchinis and cucumbers or any other green vegetable, only green leaves and fruit to make a green smoothie. Do see the recipes on our website. And also, we have plenty of smoothie events, live smoothie event in Bombay, and we also have smoothie challenges. So please do see all of those if you don't know about green smoothies. Now, in case you're hungry between breakfast and lunch, you could have your favorite snack. Just make sure that it's made according to our way. That means use oil-free techniques to make your favorite snack. Make sure that the snack is made with whole foods, and we have plenty of recipes on our website. And then lunch should be at least 1/4 of the meal should be raw, as in salad. No more than 1/4 should be grain, and the rest could be beans or lentils and vegetables. A snack in the evening could have the same formula as the morning snack, and dinner could be the same formula as lunch. Now, it could be made in a variety of ways. For example, it could be a salad and a soup which contains some beans and vegetables, and you can miss the grain because grain has to be at least 1/4. No grain, no problem. Okay, so you can make your meal plan in any way that you wish, probably something close to whatever you're consuming right now. Just don't forget to include the salad. And when you're making a meal plan, make sure that you include, as I said, plenty of raw foods, plenty of colors. See if you can include all the colors in a day. And you know, when you're having green smoothies, you've already had green, yellow or white bananas, and another fruit, say papaya, orange. You've already covered 3 colors. Then make sure that you have no more than 10 nuts a day. Make sure to have plenty of condiments. For example, yesterday I had a big salad for lunch and I made a nice dressing. That's my condiment to make the salad so delicious that I don't want to put it down. And then make sure that you make desserts now and then so that you don't get tempted with the desserts that are available in the market. I suggest learning something new at your pace every week, every month, or even if you love to cook every day. Now, what should you do when you're sick? Listen to your body. Don't reach out for a quick fix. Think about what the cause could be. Consciously remove the cause if possible and make a note not to repeat it. For example, if I went out in a polluted environment and then I was coughing, I should make sure that if next time I'm in that polluted environment, I cover this is a good time to wear a mask, right? Cover your face with a mask. Stay out of that kind of environment if possible. And, you know, give your body some time to throw out this pollution by coughing it out. Listen to your body's guidance on how to heal because your body knows. Maybe nobody else knows, but your body knows. And consult someone only if you don't see an improvement over a reasonable period of time. In order to get a diagnosis first, not in order to get medicines to cover those symptoms, but in order to get a diagnosis so that you could understand what are the causes of that disease and remove them. And many of these diseases have been covered on our YouTube channel. So in summary, health is our birthright. It's our duty to eat and live as close to what nature intended. Our body always works to heal. We should treat our body by understanding the cause of the disease and removing it rather than removing symptoms. And we should treat with a whole food, plant-based diet as the first stage of transition to a healthy diet. Now, Sharan offers a lot to help you through this. So if you go to our website, you can see a lot of information in Why Vegan. That's really worth reading. And Try Vegan is where we have nutrition facts like vitamin B12 and vitamin D and all kinds of questions about turning vegan and vegan children and traveling vegan. We also have city directories where you can learn about vegan restaurants in your area and where to get organic foods in your area. And we also have health programs like consultations and events. Now you can go right here and book a consultation, but you can also go here and see different kinds of events. And I want to share with you that for World Health Day, we have a 50% discount on several of our pre-recorded programs. And we also have a 25% discount on our consultations, all our consultations. And so if this is helpful for you, please do go there and check it out. Okay, so I just want to stop my share now and we can go to questions.
Yes, doctor. Thank you so much for that wonderful talk. I think it was a great refresher also for everyone, and also those who didn't know got a lot of clarity. So we have a couple of questions. Prerna is asking, so we should not give cow's milk or milk powder substitute to a 1-year-old baby after leaving mother's breast milk?
Yes, Prerna, a mother should provide her breast milk as long as possible, because milk doesn't contain just nutrients, but it also contains all the immunity that the mother has acquired. And so it's very important to continue as long as possible. Truly, if we consume mother's milk instead of cow's milk, we won't need vaccinations and we'll improve our immunity. But cow's milk doesn't need to be given at all once the baby gets its teeth, even if it's not consuming mother's milk.
Dr. Preeti is asking, can we have multiple fruits at a time?
So Preeti, there are people who think that you should have only mono fruits. I'm not one of them. I listen to my body, and my body often tells me, let's have only fruits for dinner. And then I pick out a few fruits and I really enjoy my dinner. So you can do it whichever way you think is best, but it should be done by listening to your body and not to some book or someone, but always listen to your body.
Tanaz is asking, what is the reason for not mixing melons with other fruits?
The digestive process of melons is a little different, but here's what I would say, that if you mix melons with other fruits and you don't get gas, you can mix. You have to listen to your body. But because the digestive process is different, we suggest that don't mix it.
Manish is saying, can we mix oats in a smoothie?
Ideally, Manish, no. I mean, let's put it this way. You can mix oats in a smoothie, but not in the green smoothie that is the morning smoothie. For example, if I were to make an oat smoothie, then I might put some oats, some nuts, some dried fruit like dates or raisins, and some sesame seeds, and make a thandai-like smoothie just for a filler, if I didn't want to make a dinner or a lunch or something like that. But I wouldn't put oats into my green smoothie, which contains green leaves and fruit. One, because I want it to be deliciously sweet. And secondly, I wanted to have the best nutrients in the world, and that is green leaves and fruit. And also, thirdly, because oats and fruit don't digest good together. So ideally, we shouldn't mix anything with fruits except green leaves. And if you want to learn more about green smoothies and why they're so good, then please read the book Green for Life by Victoria Butenko. It's a fabulous book.
Dr. Algapan is asking, is cancer a genetic disease or a metabolic disease?
Okay, cancer is neither a genetic disease nor necessarily a metabolic disease. Cancer can be caused by so many different factors, including state of mind. Resentment and anger can cause cancer, and so can wrong diet or chemicals. And so cancer is a multi-pronged disease. If you eat and live the right way, cancer is unlikely to affect you.
Dr. Amolya is saying, please tell me about autoimmune reactions after vaccination, how to get out of it.
Okay, so here's what I want to tell you. you can learn more about cancer from going to our YouTube channel, and there's a talk on cancer put up there. You can learn more about autoimmune diseases by going to our YouTube channel and seeing what are the causes of autoimmune diseases, including vaccinations, as you rightly mentioned. And obviously, if you've taken a vaccination, you can't remove it from your body. But here's what you can do. You can remove all the other causes of autoimmune diseases and wait for your magnificent body to heal.
Dr. Pratibha saying, if mother's milk is not enough, what to do?
If mother's milk is not enough, remember, we should always go to the cause. Why is mother's milk not enough, and how can we heal the mother? So how can we heal all mothers before they have babies should be our goal. But after a mother has had a baby, and if she cannot produce enough milk, then we would need formulas. And the formulas may be made with cow's milk and can cause autoimmune disease, or they may be non-cow's milk formula. And let me tell you, one of the simplest ways to make milk. You take bananas, ripe bananas, put them in a blender with a little water, blend it, and consume it immediately. That's the milk that can cause the least harm because it's the easiest to digest. But if it's a very young infant, we may need certain kinds of formulas.
Dr. Kavya is
vegan formulas too.
Kavya is asking, could you please suggest the best lifestyle before pregnancy to prepare for a healthy pregnancy?
So Kavya, I want to tell you that we have some programs. Reena, would you like to tell them about those programs?
Yeah, we have the prenatal programs that Sharmila does. And Sharma is in fact going to be having a talk today evening, which I'm going to soon share about. So do join one of those programs. And we have something else coming up for pregnancy. Keep looking at our website, and I'm sure you'll know about it soon.
But if you need it now, don't forget that we have our consultations. And right now, our nutritional consultations are at 25% off. And many of our nutritionists have brought up children on this lifestyle. And some of them have even had plant-based pregnancies. So, they are experts at this.
Dr. Ginny is asking, what about people with chronic diseases like chronic kidney disease? Can they have raw foods? What can the ideal source of protein be then?
Right. So protein, especially animal protein, is toxic to kidneys and is one of the major causes of kidney disease today. And I do understand that when someone has kidney disease, doctors tell them don't have raw foods, leach all your vegetables, and don't have fruits, because especially bananas, because they have potassium. So what do? And that's why we have our consultations on 25% off, because our doctors will advise you how to have fruits and green smoothies and vegetables and salads and get well from chronic kidney disease. But remember that chronic kidney disease is the result of diabetes or hypertension or other issues. And so I can't answer this in this short time. You need a consultation if you have chronic kidney disease.
Dr. Vilas is asking, can we mix some nuts and dry fruits in salad?
Yes, you can mix nuts or dried fruits if you must in salad, keeping in mind your dry fruit quota.
Ipsita is asking, is whey protein different from plant protein, and which is better?
Do you know what whey is made of, Ipsita? Whey is what people used to throw away when they made paneer. Like when you make paneer or when you make chicken, and you take the curd and you just take out all the water and throw it away. This water, somebody found out, could be dried up and sold as gold. And therefore, whey protein, it's something that has been advertised and it should never be consumed. It is a byproduct of milk. So it's my mistake that I didn't mention whey and all those dairy products, but whey protein should never be consumed. And you know what? Ipsita, we don't need any plant-based protein supplements either, because nature has given us all the protein we need within foods.
And Ipsita, we're having a whole program on protein coming up very soon. So you can check that out on our website as well. Rajesh is asking, is kidney failure reversible? This is referring to people on dialysis.
No, dialysis destroys kidneys so completely that you cannot reverse. So it's not reversible, but the causes of kidney failure, as in diabetes and hypertension, can still be reversed when someone is on dialysis. And therefore, it's worth going into a consultation and getting better with whatever you have left, but we cannot reverse that kind of kidney disease.
Dr. Tanaz is asking, what about oxalates in spinach and greens? Having it daily can cause stones, right?
Truly, oxalates can cause stones, but the amount of spinach that you have in a green smoothie is a handful, right? Which if you were to blends down to a spoonful. And if you were to cook, it cooks down to a spoonful. It's very little. So please don't worry about it. But the way we have prevented it is by rotating our greens. So one day you have spinach, and the next day you have kale, and the third day you have methi. Methi is fabulous in smoothies, I have to tell you. So you have different greens in your smoothie every day, and you don't even have the risk of that then.
Dr. Ranjana is asking, do we have alternative to lifelong medication to epilepsy?
So Ranjana, epilepsy is a symptom, not a disease. It's a symptom, and we have to find out what is the cause of that symptom. For example, it could be a tumor in the brain, it could be a lesion following an infection, it could be anything. So this only your doctor will be able to tell you, or our doctors, maybe after viewing all the reports. I can't tell you here.
Dr. Amulya saying raw greens hurt my stomach. Is it good to replace blanched greens instead for the greens?
No, raw greens should never upset your stomach, but they do right now because your digestive tract needs some improvement. So here's what you should do. You put minimal raw greens, just 2 or 3 leaves or 4 leaves, and start. That will not upset you. And then gradually build up. And so you will be able to have green smoothies just like you do. But we have to work, if they upset your stomach, we have to work on your stomach now.
Dr. Ruchika is saying, have IBS, lost 20 kilos over 14 years, but need healthy fat like ghee in my diet. Having a gluten-free and dairy-free diet otherwise, but natural fats like peanut, cashews feel heavy to digest. Please guide.
Okay, so this really needs, because it's individualized, this needs a personalized consultation. Like we would help you with a meal plan which doesn't contain anything that you don't need, and so on. And follow up with that so that if it's causing problems, we would change it, and so on. And lots of IBS people have got better, including some of our nutritionists who had IBS. And therefore, since for World Health Day, we have this special discount, please don't miss availing of it.
Dr. Sindhuja is asking how to cure eczema for my baby since the 2 months of birth up to 3 years now.
Okay, so as I said, the answer is within you, Sindhuja, right? That means the cause, and I'll tell you, one of the causes can be even mother consuming dairy and feeding mother's milk to the baby can cause eczema. It could be vaccinations, it could be various things. And therefore, for these individual complaints, we may need a consultation. But Sindhuja, please don't wait. It's time to get your baby, small baby with eczema. That's really sad to hear.
Doctor, last 2 questions I'll take. So formula milk can be given without cow's milk ingredients till 2 years. Prerna is just confirming.
Yes, if you get the right formula. Most of the formula is made from cow's milk, but you can get cow's milk free formulas. But listen, babies don't need formula milk till 2 years. Babies need formula milk till 6 months. And then if they don't have mother's milk, they need high quality foods, which will be better than formula milk and packaged formula milk.
Dr. Ginny is asking, what is the root cause of psoriasis?
Psoriasis is an autoimmune disease, and the root cause of all autoimmune diseases, and they have become so common these days because of the vaccination campaign. So the causes of autoimmune diseases are vaccinations, are viral diseases, even COVID can cause autoimmune disease, are animal proteins or proteins foreign to our body. Therefore, wheat and animal proteins can also cause. So please do watch that talk on autoimmune diseases on our YouTube channel. And if we can help you, don't miss our discount on consultations.
Okay, doctor, thank you so much. I think we've actually covered all the questions, and I'm sure
that's fabulous.
Yeah, there's been a lot of sense of clarity today. And may you keep helping many, 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 many more. And there should be a day where we don't need World Health Day because we are all healthy.